Today we'll be learning about tuberculosis, commonly referred to as TB. In this lecture, we'll cover several important points. Here's what we'll discuss: what TB is, its definition, the types of TB, symptoms of TB, where TB is found globally, its epidemiology, risk factors for TB, how TB spreads, its transmission, how TB is diagnosed, possible complications of TB, how TB is treated. Let's dive in. Let me tell you first, what is TB? TB is a contagious and potentially fatal disease. Contagious means it can spread from one person to another. For example, like coronavirus, TB spreads through droplets when an infected person coughs, sneezes, or even talks. TB is considered fatal because if left untreated, it can result in death. The organism that causes TB is called Mycobacterium tuberculosis. Although most people associate TB with the lungs, it can actually affect any organ in the body, causing damage if untreated. Now, let's explore types of TB. There are two major types of TB. One, pulmonary TB. This type affects the lungs. Two, extrapulmonary TB. This type can affect other organs. Examples of extrapulmonary TB include lymph node TB. This affects lymph nodes. Pleural TB. This affects the flora around the lungs. Genitourinary TB. This affects the reproductive and urinary systems. Skeletal TB. This affects bones. Gastrointestinal TB. This affects the digestive system. TB meningitis. This affects the brain. TB pericarditis. This affects the heart lining. Epidemiology of TB. According to the World Health Organization, WHO, there are over 5.7 million terabytes cases globally, most of which are in developing countries. Do you know how TB spreads? TB spreads through the air via droplets. Similar to COVID-19, when an infected person coughs, sneezes, or speaks, the droplets can enter the mouth or nose of a healthy person, causing infection. Risk factors for TB. Certain factors increase the likelihood of contracting TB, including 1. Close contact with a TB patient. 2. Weakened immune systems, such as in cancer patients, HIV/AIDS patients. 3. Chronic illnesses like diabetes, kidney or liver disease, alcohol dependency. 4. Travel to areas where TB is widespread. 5. Healthcare workers who are regularly exposed to TB patients. Symptoms of TB. Common symptoms of TB include persistent cough lasting more than 2 weeks, coughing up mucus or blood, chest pain, loss of appetite, fever, night sweats, chills, unexplained weight loss, fatigue. If someone has these symptoms, they may have TB. Diagnosing TB. To confirm TB, doctors follow these steps. 1. Take a patient's history to check if they've traveled to high-risk areas, if they've been in close contact with a TB patient. 2. Perform a physical examination, including checking for finger clubbing, feeling for swollen lymph nodes in the neck, indicating pleural effusion, listening for crackling sounds in the lungs. 3. Run lab tests, such as chest X-rays to spot lung damage, sputum tests, for example, Genexpert and fungal IV tests, tuberculin skin test, PPD test, to check for TB bacteria. If these tests come back positive, the patient has TB. Complications of TB. If untreated, TB can lead to serious health issues, including bone damage, brain infections, kidney or liver damage, heart problems such as TB pericarditis, pleural effusion, fluid around the lungs, TB pneumonia, hepatotoxicity, Liver damage. Preventing TB. Here are ways to protect yourself from TB. Cover your mouth when coughing or sneezing. Wear a face mask in crowded areas. Complete the full course of TB medication. TB treatment usually lasts 6 months, and it's crucial not to miss doses. Missing doses can lead to MDR TB, multi-drug resistant TB, where medication stops working. Vaccinate against TB. Isolate TB patients. Similar to how we isolate COVID-19 patients. Treatment of TB. TB treatment typically lasts between 6 to 12 months, but the standard duration is 6 months. 1. First 2 months, patients are given myron tablets, which contain streptomycin, isoniazid, rifampicin, pyrazinamide, F-and-butol. Next 4 months, patients take myron 4 tablets, continuing the treatment. Question of the day. What bacterium causes tuberculosis? Think you know the answer? Drop it in the comments below. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain and eyes, visit my channel to view my other videos.